Indiana's unprecedented HIV outbreak is rapidly spreading. As of today, 142 people have tested positive since December, and the outbreak is no longer contained to just Scott County. The state health department announced this week 5 cases of HIV were confirmed in Jackson County. As Barbara Harrington reports, health officials, politicians, and everyday people remain at odds over how to stop HIV from spreading.
The streets of Austin are lined with campaign signs focusing on the future of this struggling small town. They're on every corner and every yard, even greeting drivers on the outskirts of town. But it's the handwritten sign posted on Tammy Breeding's lawn that sends perhaps the most powerful message of all.
I had to make a statement. I want to take back my community, my neighborhood.
Breeding's neighborhood is the epicenter of an HIV outbreak unlike anything the Centers for Disease Control has seen in rural America.
Little baggies of paraphernalia that they have their drugs in, they'll just toss it down in the ditches.
Health department officials say people are spreading the disease primarily through intravenous drug use. And that's a problem Austin's been struggling with for years. You don't have to walk far down North Church Street before you find someone looking to buy or sell drugs.
The main drag, what I call it, is Church and Broadway. This is like a meeting corner for the drug deals, the prostitutes. You can see it go from one house to another down this strip here of where they're going to get their next fix. And they call them the shooting galleries because they go to get a shot and then they get high and then they walk to the next one.
It's gotten so bad. Some neighbors are putting up barricades to prevent addicts and dealers from using their driveways as trade-off points. And Breeding says a temporary needle exchange program Governor Mike Pence authorized is only making the situation worse.
I think if they continue this needle exchange, you're going to have the worst epidemic with drugs coming in from all over, that it's not going to be able to be contained the way they need to contain it.
The exchange is part of the state's effort to curb the outbreak. It's set up in a community outreach center in Austin and allows addicts to get enough clean needles for 1 week. They give their first names and get an ID card to join the program. So far, participation has been low.
We had to design the program from scratch. Nobody's ever done this before. So it took a while to design the program, and then once we started, it takes a while to gain people's trust, especially this population. They're not trusting.
The governor's executive order authorizes the program through May 25th and only in Scott County. But HIV is spreading. There are now 5 cases in Jackson County, Scott County's northern neighbor.
The 5 cases that are reported in Jackson County, all of the contact tracing is complete. And so we feel that those 5 cases have been isolated and contained.
That's a line some folks aren't buying.
For the governor to think that he can contain the epidemic in Scott County with an emergency order is reckless and will cost the lives of thousands of Hoosiers.
Shane Avery works as a doctor in Scott County and was one of several people who testified during a House committee hearing this week, asking legislators to make needle exchange programs legal in high-risk communities. The bill would allow for local needle exchange programs in areas with high rates of hepatitis C, which is often an indicator of HIV. Proponents say the programs effectively quell outbreaks, but not if they're limited.
They know it's a bigger problem than Scott. I've not heard anyone make the statement that the state has been making, which is this is only Scott and this is only the situation, and when it's all over, it's all over. I think everyone knows this is a long distance run. It is a lifetime need until these people have treatment services available to them.
Executive Director of the Indiana Prosecuting Attorneys Council, David Powell, was the only person at the hearing to speak out against the needle exchange bill. He says legislators need a more long-term solution to the outbreak that addresses funding and substance abuse treatment.
If you at some point want to incorporate a needle exchange program in that mix, then that's your call, obviously. We just think it's too early to do that, and I'm worried that if you do that, you think you fix the problem. Without treatment, without testing, without addressing these other more critical, more expensive public health needs, you don't fix anything.
On the streets of Austin, residents, including Clyde Polly, worry about what will happen if legislators don't make the needle exchange permanent. He's seen firsthand what an addict's desperation can do. His son was diagnosed with HIV and is now in rehab, trying to kick the habit.
They do it 3 and 4 and 5 times a day, you know. They can't do it just one time a day. It just goes, they do the thing one time, then a little bit later they'll be looking for another dose of it.
Polly sees the needle exchange program as a godsend. Extending it and getting more legislative help and state resources, he says could combat the town's crippling drug problem and lead to real change on Austin's streets.
I don't know what's going to happen down the road. I'd like to see it all change. I don't know how much hope there is for it to all change, though.
The proposed needle exchange bill wouldn't provide any funding to help local communities establish exchanges. Reporter Barbara Harrington has been following the story for weeks and joins us now. Barbara, are there any plans to extend the needle exchange program or HIV testing in other counties?
At this point, no, Joe. The state says they're solely focusing on Scott County. That's what the governor's executive order allows them to do. Now, they say they won't turn anyone away from free HIV testing. They want people to get tested and find out whether or not they're positive. But that needle exchange program only for Scott County residents. The CDC, however, though, today did issue a health advisory, and this is nationwide, letting people know that there is this drastic increase in hepatitis C throughout the country where intravenous drug use is happening, and letting them know that, hey, this could lead to an HIV outbreak. Here's how to prevent that from happening.
Now, you've been down in Scott County, and we can see the presence. I mean, you're seeing those road construction signs flashing for a health emergency. How big is the presence down there?
It's huge, Joe. There are little signs throughout town pointing people to this community outreach center. They want people to go there. And in addition to that, there are state health departments from Missouri, Virginia, and Colorado who have disease intervention specialists there on the ground. They offered up their help to help do contact tracing, track down people who have come into contact with people who are HIV positive. The state says they still have to get in contact with over 100 people that they have to do that tracing for.
But does the state think that it's been successful so far?
They're really not saying at this point. They say it's too early to tell. They are having more people come through, get tested, which we're seeing with the number of cases going up. They're having an increase in the needle exchange program participation, but they say it's just really too early to evaluate if this is being effective at this point.
How does the Scott County residents feel about all these people coming into their community?
They said it's been a long time coming, frankly. We heard them talking about how this drug problem has been going on for probably about a decade. And some of them are frankly angry that it took an HIV outbreak to get the state in there to help out.
Okay, thank you very much, Barbara.